My name is Tabitha Beckens, and my research is on cancer in Denmark. Denmark is officially known as the Kingdom of Denmark. It is located southwest of Sweden, south of Norway, and bordered to the south by Germany. Their population is approximately 5 million people, and the country is the world's cancer capital. The question is, why are cancer rates so much higher in Denmark than anywhere else? The weather is an average, with lows of 32 degrees Fahrenheit and highs around 63 degrees. Their government is a constitutional monarchy. Statistics show that 326 out of every 100,000 people develop cancer each year in Denmark. Denmark has a remarkable diagnostic and detection program which accounts for the high numbers of cancer diagnoses in the country. Diagnostics are better than most countries in the world, therefore they can catch it earlier. Cancer is the leading cause of death in Denmark, where 3 out of 10 deaths in 2010 were attributed to cancer. The majority of cancers diagnosed are directly linked to the lifestyle of Danes. Wealthy populations have unhealthy lifestyles that put them at higher risks for developing cancer. Lifestyle factors that attribute to cancer rates in Denmark include a large average of women who smoke cigarettes, high levels of alcohol consumption, little to no exercise, and an increase in sunbathing and tanning bed use, especially at younger ages. Scientists estimate that approximately 1/3 of the most common cancers in the UK can be prevented by maintaining a healthy lifestyle. There are hundreds of cancer treatment drugs. Some of the more common drugs that have been used in Denmark are celecoxib, NSAIDS like aspirin, Asparaginase, and Taxol. Celecoxib is a compound that is very selective. It inhibits cyclooxygenase 2 enzyme. Here in the United States, it is owned and sold by Pfizer as Celebrex. The average cost is around $2 to $5 per pill. In Denmark, a study showed that users had reduced risk of skin cancer and that it may prevent the development of cancer by inhibiting the cyclooxygenase enzymes. Asparaginase is a type of chemotherapy drug that is derived from E. coli. It is used for the treatment of acute lymphoblastic leukemia. It is an enzyme that breaks down the chemical in tumor cells that is needed to replicate new cancer cells. It is injected into a vein or into muscle. In one study, patients in Denmark that received the enzyme had significantly longer remission times, with an estimated 45 months as opposed to 20 months without it. NSAIDs, or non-steroidal anti-inflammatory drugs such as aspirin, also known as acetylsalicylic acid, have been studied in Denmark to see what effects they have on cancer. Results indicate that long-term use may reduce your risk of squamous cell carcinoma and malignant melanoma in regards to skin cancer. Taxol, or paclitaxel, is a chemotherapy drug. It is derived from the needles of the Pacific yew tree. It works by blocking the replication of cancer cells. There are many types of cancer treatments that Taxol is used in, such as ovarian, breast, and non-small cell lung cancers. Taxol is given through an injection into a vein, either into an arm or into the chest. Dosage depends on the course of treatment and the type of cancer being treated. More than 10 in every 100 people have one or more side effects. There's an increased risk of infection due to white blood cell drops, headaches, muscle aches, sore throat, painful urination, tiredness, breathlessness, feeling of being cold, easy bruising, nosebleeds, bleeding gums, hair loss, mouth sores and ulcers, and many more. There is also a chance of an allergic reaction, which when given with steroids, helps reduce the allergic reaction to Taxol. Today, ongoing treatments show significant improvements are being made. For example, in 1960, approximately 30% of children diagnosed were still alive 5 years later. Today, with successes in treatment and continued research, nearly 90% of children diagnosed are still alive 5 years later. Today, there is ongoing research to continue the success of Danish diagnostics and treatment. Success attributes to effective surgery in combination with radiation treatment and chemotherapy. This concludes Cancer in Denmark. Thank you for watching.